Today we learn some of diabetes mellitus medications part 6 thiazolidinediones. Channel's name is Heartbeat. My name is Dr. Amrit Kejriwal. Introduction. They are used for treatment of type 2 diabetes mellitus, introduced in the late 1990s. They are also known as glitazones and may be used in combination with metformin and sulfonylureas, and can be used as monotherapy, especially if metformin and sulfonylureas are contraindicated. Again, lifestyle modification, diet and exercise is required. Whichever diabetic medicine you're taking, the lifestyle modification, diet and exercise has to be done. Mechanism of action. It acts by activating PPAR gamma, that is peroxisome proliferator activated receptors gamma. Now I will not go into the details of this complex name. Basically, they help in removing fat from circulation and enhance storage in fat cells. So more insulin is available to other cells, and decreased glucose formation from fats and protein occurs. So these receptors are present in the fat cells, body muscle cells, livers, inner lining of blood vessels. So they're widely distributed. It's quite possible the adverse effects of these medications may be more. Effects on cholesterol. So they basically increase the HDL cholesterol, increase LDL cholesterol, and decrease the triglycerides. So it has a beneficial effect overall on the cholesterol. They have group members: pioglitazone, rosiglitazone, and there are some others which I am not discussing. Even rosiglitazone has become obsolete now, not used. And a liver test and HbA1c should be measured, and effects are seen in 6 weeks to 6 months. Pioglitazone. The recommended dose is 15 to 30 mg once a day. Maximum dose is 45 mg per day. And these are absorbed within 1 to 2 hours of ingestion. Elimination half-life is around 3 to 7 hours and can be used in minimal kidney disease, avoid in liver disease. Rosiglitazone, a member of the same family, has become basically not to be used now, but it's still available in some countries of the world. So initial dose is 4 mg once a day, may be increased to 4 mg twice a day, absorbed within 1 to 2 hours. Elimination half-life is 3 to 4 hours. Since there was increased risk of heart attacks, that's why this drug has been stopped, but still available somewhere. May cause liver damage, can be used in minimal kidney disease, but avoid in severe kidney disease. Side effects. Water retention leads to swelling, precipitating heart failure, so it causes weight gain also. Water retention. So weight gain and this increase in body fat. Avoid combining with insulin, because insulin also causes weight gain and these molecules also cause weight gain. So you avoid combining with insulin. Increase the risk of fractures, that is pioglitazone more than rosiglitazone. So again, these drugs become very unpopular. And there's a theoretical risk of increasing SARS-CoV-2 virus infections. Not proven, but yes, there is a theoretical risk as of now. Pioglitazone to avoid known bladder carcinoma patients. And if liver enzymes increase more than 3 times normal, then avoid these medications. Thank you for watching the video. Please do not forget to like the video. Feel free to give comments. Please subscribe to the channel and share the link with your friends. Thank you once again.